Oh, hey, how you doing? Oh, that's good. Yeah, I'm Dr. Core. You here for your cranial nerve exam? Yeah, that's good. That's good. Yeah, you need to get that checked up annually. Yeah. So, yeah, you can just come in and sit down. Come in and sit down. Yeah, we got a lot of patients today, so I'm trying to, get people in and out today. So, I'm just go ahead and get started with you, and ask you a couple questions, and then we get started with the exam. Sound like a plan? Sound like a plan? All right, let's go ahead and get started. All right, we're just gonna start off with your name. Can I get your name? Okay. All right. Your date of birth. All right. And can I get your address? All right. Cool. All right. Do you got any concerns? Any questions that you got for me? Nah, nothing. You just getting a checkup, basically. All right. All right. Cool. All right. Cool. All right. And you already filled out the paperwork in the front, right? Yeah. Okay. Just making sure. I always gotta ask, cause sometimes the nurse will forget to give the patient the paperwork to fill out, all day, allergies and things like that. So I just wanted to make sure. So yeah, I'll go ahead and get started with you since we already got all that information. So here's what we're gonna start. We're gonna go ahead and start with your eyes. So I'm gonna have this light right here, right? I'm gonna have you follow the light for me. Okay? Okay. Alright, the light's gonna be a little bright, so just bear with me for a minute. It shouldn't be long. Alright, here we go. Good, good. Just keep following the light. Good. Perfect, perfect. Alright, alright. Alright, cool. So your eyes track the light really well. So now, I'm about to just go ahead and take a look inside your eyes. So go ahead and just look past me real quick while I shine this at your eyes. Don't want to be staring directly at the light, you know what I'm saying? So just look past me and I'm going to take a look in your right eye real quick. Alright. It's looking good. It's dilating well. Alright, cool. Make sure I'm covering this left eye here. Alright, that looks good. Alright, I'm going to switch eyes. Okay. Looking good, looking good. It's reacting how it's supposed to. Good, good, good. Alright, so your eyes are reacting how they're supposed to. They're dilating well. All around is good so far. You track the light pretty well. Things like that. So, alright, I got another eye test for you here. So what I'm going to do is hold up 2 fingers on both hands. You're going to just look straight forward. And you just let me know which fingers are moving, okay? So yeah, just let me know left or right. And then we gonna do it like that. You got it? You got it? Alright, cool. which ear you're hearing it in, okay? Okay. Let me know. Good. 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 Perfect. 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 Good. 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 Perfect. Perfect. Good. 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 Okay. So you did real well on that test. Alright, for the next test, we're gonna go ahead and test your nose out. So I got some pieces of paper here that we sprayed with different smells. And I just want you to tell me, what are you smelling? Okay. Okay. Here's the first smell. What does it smell like? Good. Next smell. What does it smell like? Good, good. Alright, here's the third one. Great. Perfect, perfect. Alright, what does it smell like? Perfect. That's your favorite smell. That's good. Probably recognize that one instantly. Alright, next smell. Yeah, it's a little tricky. Perfect, you got it. Alright, last smell here. What does it smell like? Good, good, good. Okay. So you got them all right. So that's good. Alright, so I'm gonna go ahead and move on to your taste now. So we got different flavors here that I'm gonna have you taste. And you just let me know what it is. Alright, first one. Great. Okay. Next one. Perfect, perfect. Next one. Good. Okay. Next one. Perfect, perfect. Alright, got one more. Alright, next one. Perfect, perfect. Alright, you did great on both of those tests. So, now we're gonna go ahead and I'm gonna get this tape measure out. And basically I'm just gonna kind of measure like the distance between your eyes and like, you know, distance between your ears. Just kind of measuring things out. Alright, I'm gonna go ahead and get started on the measuring. So just measure the distance between your eyes, your mouth and nose. You know, things like that. Go ear to ear with it. Yeah, this is a new thing they got us doing. You know, we gotta measure the forehead also. We're doing all that. Alright, cool. Length of the head. This kind of tells us like, it gives us like a little rough draft of like, you know, what we're dealing with a bit. Cause some people got like abnormally longer, whatever, you know what I'm saying? So it might affect, you know, their breathing just, one more thing. Let me just check your eyes one more time just to make sure. Because I feel like I did see something in your eye. Like a little red spot or something. But I just wanted to make sure, just for the record, make sure it's not anything concerning. Just check. Okay. Yeah, I think it's normal. Did you get hit in the eye recently at all? No. Have you scratched your eye? You just casually just something got in your eye, just kind of rubbed it a little too hard. Anything like that? You probably haven't, you probably didn't really notice. You know what I'm saying? If you did, that's just something we just casually just in your eye and you don't really notice it until later on when your eye's kind of hurting a little bit. And you're like, oh, I wonder what happened. You probably rubbed your eye a little too hard. Because it got blood vessels in there and stuff like that. And if you rub too hard, you can rupture one of them. So yeah, it looks like it's only in this eye right here. Little red spot. But other than that, it doesn't seem like it's anything concerning. It doesn't look crazy or anything. It doesn't look like anything major. It'll go away, within a few days or so. Yeah, I just wanted to take another look at that just to make sure, what I'm saying? I like to make sure, other doctors, they just kind of go through their exam procedure and all that and just kind of willy-nilly, what I'm saying? They look at it once, but me, I like to make sure, double check on things of that nature, what I'm saying? But yeah, you pass with flying colors, what I'm saying? Yeah, you did great. Perfect. We don't really need anything else because, you filled out the paperwork and all that. Yeah. If we need to prescribe anything, yeah, we already got your paperwork filed and everything. So, yeah, you're good to go. So, yeah, it was nice to meet you. Yeah, it was nice to meet you. I'll see you next year. Okay, bye-bye.